church say amen. Amen. So we've come to celebrate our health. We've come to be good stewards of our bodies. And so we want you to do at least 4 things today. Are you working? We're not going to ask for any money. Normally when you're in church, they ask for a little bit of money. We're not going to ask for any money this morning. Can you do 4 things for me? First thing I want you to be is excited. Say excited. So we're going to be excited all day long. Not only are we going to be excited, we're going to be what? Engaged. Oh yes, and when the speakers are presenting and you're going to be listening and you're able to ask questions, we're going to be excited, we're going to be engaged, and when we do those 2 things, we're going to be empowered. Say empowered. And after be empowered, then you can live our life with excellence. So we come to be excited, we come to, what's next? Engage. After we engage, we're going to be empowered. After we empower, we're going to do what? We're going to live in excellence. Won't you stand up and stretch and give yourselves a hand clap this morning and just thank God for a wonderful day of being able to come out, to be able to learn, to be able to know more about your health, to take care of yourself. Amen. One of the greatest things you can do, my brothers and sisters, one of the greatest things you can do is take care of yourself. Because your loved ones are counting on you to take care of yourself. Amen. Amen. Why don't you have a seat? I'm going to bring forth our host for today. Very distinguished position in this area, a dear friend, one who cares about his community, one who wants his community to live a healthier and richer life. You saw him running around already, handing out bags. A lot of other people want to be doing it. Everybody else doing a little something, but this is the kind of person who don't mind putting his hands to the plow to make a difference in this community. Won't you stand and won't you just put your hands together and thank Dr. Keith Howard Newby as he comes forth on this morning. Amen.
Good morning, good morning. You see why I have him up here, don't you? He gets everybody all energetic. So listen, thank you all for coming today. I really appreciate the time. This is an important event. It's important because it's all about you. And it's about you, your families, your loved ones. Our job, as I see it, is always to give back. The good Lord's blessed me with a lot over the years. He's blessed me with a good mind. You know, a just ability to help others, and I enjoy doing that, and that's what I feel like I do best. So I just appreciate you guys coming out to listen to what we have to say today. Just to kind of give you some heads up, the events today, and I took a lot of time to carefully think about what I wanted to present today. Normally I always get up and have a heart disease talk, and that's been standard, but I excluded myself today because there were more important things I felt I wanted to emphasize. You know, we always talk about how people die of heart disease, but we rarely focus on what causes heart disease that leads to that, which leads people to sometimes not be here with our loved ones. So we focus on how do we stay healthy, not just heart-wise, but just period. What are the things we need to look for? This is the preventative age. We don't want to wait until things are already in place. We want to catch it ahead of time. We catch it ahead of time, that leads you to being a healthier person, less stress on you, less stress on the family, and that's what our focus is going to be today. So the agenda today is as follows. The first thing we're going to do is talk about early detection of cancer. That's going to follow by a diabetes lecture. We're going to talk about caring for the elderly population. And part of why I wanted to bring that to the forefront is, you know, we are in an age where people are living longer and having more health challenges. Trying to, as some of us are taking care of our aging parents, how do we do that? What are the resources available that allow us to be able to do that? If you go on the website, you may not find much of anything, or it'll put you in the circle and with nowhere to go in the end. So I thought it was important to figure out how do we care for our loved ones as they get a little older, and then we're going to finish that up with how do we eat healthy, because I tell you, when you talk about heart disease, diabetes, hypertension, cancer, a lot is related to how we live. How do we live our lives the healthiest and the fullest? So we're going to have people coming in to talk about that. So now, and the final issue was going to be, we're going to do a panel discussion on the Affordable Care Act. Now I know since number 45 has been in office, we have heard there's been the ever-going debate, even when President Obama was in office, about the Affordable Care Act and what it is, what it means, what are the pros and cons. Now, this is a nonpartisan discussion. This is not Democrat, Republican, but I wanted a panel that would look at it from a true sense. What are the pros and cons of the law? What are the things you need to know about health insurance issues in general? How does that even work? And I bet you a lot of you don't even know. And it's difficult to work through. So it's time for us to have a real discussion about that. So that'll be the last thing we're going to do. Now, we're going to raffle off some stuff. So I want to make sure people stay for this whole thing. We're going to raffle off an electric bike. I have an iPad mini we're raffling off. I have a couple of gift certificates to restaurants, but you got to promise to eat healthy if you go there. And we have a Fitbit watch and the scale that goes with it. That I want to really engage people to really enjoy what we have to say, but we know at the end of all this, we're going to have a good time. Now, is Pastor Daniels in here? Okay, I see. Oh, there. So I wanted to, just two things. I wanted to introduce her real quick as the host of the establishment that welcomed us with open arms to come in and have this ability to have this discussion. And we are filming this, so we're going to be putting this on YouTube and everything else. So I wanted to make sure people know if you didn't want to be seen, I'm sorry. It is what it is. You know, so just make sure you put on a good smile. Don't fall asleep back there because you may be getting filmed at that time. So make sure you stay awake for all this. But I'm going to bring Pastor Daniels up, and I'm going to make one introduction, then we're going to get going.
Praise God. Praise God. Praise God from whom all blessings flow. I am Sherry Daniels, and I am the senior pastor of Norfolk United Methodist Church, as Dr. Newby has just said. But I want to welcome you here and want you to know that we have persons that are dressed in black and white. If you need to know anything about the Norfolk Church, let's see one of them. The pastor has on blue jeans today. Don't ask me anything because I fail to know much of what I need to know. But it is a joy to have you here. It was a pleasure to have a moment with our mayor, Mayor Kenny Alexander, to do an interview with us and to be in partnership with this tremendous doctor in our community, Dr. Newby, is just something that is near and dear to us as a church now. And the partnership will continue. So he has put together this summit in such a way that we can't help but go away feeling better about ourselves, better about our communities and all that we do. So God bless you and your day ahead.
And just before we get started, I wanted to take the time. I invited our mayor to come out, and I'm going to ask him to say a couple of words. I wanted to let you all know that this is not just a Fort Norfolk event. This is a Norfolk event. This is a citywide event. We have the full support of the city of Norfolk and the things we're trying to do, which is to empower people, to allow them the opportunity to become educated and to understand what it takes to have good health. So to really start that kickoff session, I asked the mayor, would he lend a few words to us, if he come and just give us some encouragement, and he is always expert at doing so. So I wanted to take this opportunity to introduce my dear friend, Mayor Kenneth Cooper Alexander. Appreciate it.
Thank you for all being here. Dr. Newby, we owe you a debt of gratitude for just bringing us together again, and Pastor Daniels for being such a generous host, and to all of the Norfolk United Methodist Church. Thank you for your service. The city of Norfolk certainly endorsed Dr. Newby in this effort. He is a partner in a healthy Norfolk, and his team, and all of the vendors that are here. We're interested in helping you live longer and help reduce diseases that are preventable. Strokes and diabetes and cancers and high blood pressure. A lot of these diseases are preventable if we have the information, if we're empowered, and if we change our behavior. So we are here to support, we're here to listen, we're here to learn, and we're here to make sure that we have a healthy Norfolk. So let's have a great summit. Dr. Newby, you and your team, again, thank you for what you do. You're just an amazing talent, and we bless you, and we pray that God will continue to use you in a mighty way. Thank you for being here.
Thank you. Appreciate it. Thank you, Mayor Alexander. So let's go ahead and get going, because I know, and I really do appreciate it. I know taking your time out on a Saturday is always tough. I know you guys have things you're trying to do, and you took the time to come here to listen to this, so it is greatly appreciated. First up is going to be cancer, importance of early detection. I have with us today Dr. Mark Fleming, who is both a dear friend, church member. He's with Virginia Oncology. And he and I, we have these discussions. We always talk about how much we work, and he'll text me and he'll joke with me and saying he knows like 10 o'clock. He said, I'm doing Keith Newby hours tonight. So, and I'm texting him right back, because this is what we do, but we share information with each other, that which is going to help the community. So we are fully engaged, as he has been for the last several years that he's been in the area. So I wanted to take no further ado to introduce Dr. Mark Fleming.
Good morning. We had a little technical difficulty this morning, and my presentation wasn't able to be hooked up, but I think we can work with it. So if you forgive me, I'm used to kind of working off PowerPoint slides to keep me organized. So what I want to talk about today is really the early detection of cancer. And I kind of have a sub-expertise in cancer care. I am a GU medical oncologist. I see lots of prostate cancer, bladder cancer, kidney cancer, and testicular cancer. And when we think of the diseases that we can prevent, there are several cancers that we can prevent, and it's really because of early detection. When I say kind of prevent cancer, that we can find it at a stage where it is curable. Some cancers are inherited. Most cancers have to do people's lifestyles from that perspective. So let's start with the first one, the biggest one. Does anyone know what's the biggest killer of cancer patients in the U.S.? This is an open discussion. I couldn't hear you. Lung cancer. So let's talk about lung cancer. Lung cancer is highly, highly, highly preventable. The biggest thing one can do to prevent a lung cancer is don't smoke. And the second thing you do, if you do smoke, is stop smoking. So smoking is a lifestyle. If you modify your lifestyle, you can prevent the majority of lung cancers, because the majority of lung cancers happen as a result of smoking. There are some, mesothelioma in particular, that can happen as a result of occupational exposure, and you can just watch TV. I watch Judge Judy when I'm not texting Dr. Newby about working hard. And you can see all the commercials about call 1-800-LAWYER if you've been exposed to asbestos and you have mesothelioma. But the majority of lung cancers, and the more people die in the United States of lung cancer than any other cancer. So what do you do if you are a smoker or you were a smoker? Well, we now know that if you smoked more than 30 pack years, that's how we kind of look at the risk of lung cancer, is what's called pack years. So it is different if you smoke 1 cigarette a day or 1 cigarette in your lifetime. I think when I was 18 or 19 years old, I went off to college and I experimented. I experimented with a cigarette and it wasn't for me. So my pack year, I do not have a pack year history because I smoked 1 cigarette in my lifetime. Didn't like it, wasn't for me. But you really can look out how many packs a day someone smokes. So if someone smokes 2 packs a day for 15 years, they have a 30-pack year of smoking. And anything greater than 30-pack years of smoking, we have shown that the early detection of lung cancer is beneficial. And that's with a test called a CT scan. It's a low-dose CT scan where you go into a machine and they take a picture of your lungs. They recommend that yearly for someone who has been exposed, who has greater than 30-pack year history of smoking. So what can you do? You can not smoke. You can, if you do smoke, you can stop smoking, because if we look at people who used to smoke and they stop smoking, over time, the risk of smoking returns after about 5 years to a normal person's level. So it's very important to talk to your loved ones in terms of stopping smoking. Primary care physicians are excellent at, there are multiple medications, there's lifestyle modifications in order to stop smoking. So I wanted to touch upon that. Breast cancer. As I look around the room, the majority of the women I see are over the age of 40 years of age. And if that is the case, then you should have had a mammogram at this point in your life. At age 40, at a minimum, you should be getting a baseline mammogram. If you have not got a mammogram, then you should. If you should talk to a loved one if they haven't had a mammogram, that they should, because breast cancer, when detected early, is usually a curable condition. My mother has breast cancer. She got yearly mammograms, and it was detected early, and she is now cancer-free, now greater than 10 years. And so, yes, did she require treatment? Yes. Did she require surgery? Yes. Did she actually require chemotherapy? She did, but because of her early detection of her breast cancer, she was able to meet her grandchildren, most importantly, her youngest grandchild, Colin. And so that's why that's why early detection is important, because don't just think of yourself because people are afraid. I have seen breast cancer masses as the size of a grapefruit, okay, that the patient knew, family likely knew, but because they were afraid, they didn't get tested. In fact, I had a woman whose breast mass got so big that her breast fell off because it got necrotic and it smelled. And that doesn't happen over weeks. That doesn't happen over months. That happened over years of just neglect, of not wanting to address it. So we have to have those tough conversations with our family members, not to be afraid, and doctors are here to help you. So for breast cancer, you should be getting a mammogram at least yearly, age 40, some people will say 45, if you have a strong family history. And so for African American women, there is a special type of breast cancer. Well, it's not unique to African American women, but what's called triple negative breast cancer. Triple negative breast cancer is highly aggressive. And so if you have a loved one who's been detected with the cancer at an early age, or an early age is less than the age of 40, a simple rule is subtract 10. So if you have a family member who got diagnosed with a breast cancer at age 36, then her loved ones in her life should be getting mammograms at an early age. And in fact, there are other tests called a breast MRI that they can get to help prevent that disease. So you get a mammogram yearly. They're very good about reminding you to get yearly mammograms, and as you get older, it might spread out over time. So we've talked about lung cancer, we've talked about breast cancer. I don't have enough time to talk about treatments. I'm sure I might get some questions. Another cancer I want to talk about is prostate cancer. I see lots of prostate cancer, and some would say that I'm a, quote, prostate cancer expert. And my hero is my father, and I actually lost my father to prostate cancer. So what's controversial about prostate cancer is it's unclear in terms of the guidelines when you should start and who should start it. Well, this is Mark Fleming's recommendations regarding the early detection of prostate cancer. If Dr. Newby had asked me, Dr. Fleming, let's do some prostate cancer screening, I would have said, Dr. Newby, I don't believe in prostate cancer screening. And he would have taken a step back, and usually I do whatever Dr. Newby asks me to do. However, prostate cancer screening is taking a random population of patients, and you give them what's called a blood test called a PSA test. And I would have said, no, Dr. Newby, I do not believe in doing a random population of patients and taking a PSA. I would say yes to Dr. Newby if he says we could have an educational session about the importance of prostate cancer. You allow us to do a digital rectal exam. A digital rectal exam is an exam where a doctor takes a gloved finger, lubricated, and is able to feel a prostate on a man. And then I would say, if we also were able to do PSA testing, then Dr. Newby, I would be willing to do that type of testing. So I don't believe in screening, because screening is a random group of patients, but I do believe in an informed group of patients understanding the risks and benefits of treatment. And let me tell you why. Well, prostate cancer can be aggressive, especially in African American men. The American Cancer Society advocates you having a discussion before you getting a blood test as well as that digital rectal exam. I have had 89-year-old men come to me with a history of congestive heart failure. They're seen by Dr. Newby. They're on dialysis, and their loved one heard a talk about prostate cancer screening, and they wheel him in a wheelchair, and they say, well, let's test his PSA. Well, the reality in that situation, in an 89-year-old who comes in with congestive heart failure, with end-stage renal disease in a wheelchair, his prostate cancer, if diagnosed, is not going to be his major issue. And so you always have to balance the age, the other factors from that standpoint. So what you did not hear me say is, Dr. Fleming says, don't test an 89-year-old. What I said was, you have to look at each situation in particular. For African Americans, at age 40, I think it is a reasonable, appropriate time to begin the early detection of prostate cancer, which means a digital rectal exam, a PSA blood test, and information about the risks and benefits of a positive test. Because the only way you can detect prostate cancer is with a biopsy, which can be an uncomfortable procedure, but necessary. So we've talked about breast cancer, we've talked about lung cancer, we've talked about prostate cancer. Colon cancer is probably the most preventable with our screening tests, and how you detect the early detection of colorectal cancer is through either a colonoscopy, a test where you test the stool, you've seen the commercials on TV, and kind of knowing your body. And so I've stood in Fort Norfolk, and hopefully the United Methodist lets me do not Fort Norfolk, excuse me, First Baptist Church. I don't have a mic, but everyone, we all have to go to the bathroom, and when we go to the bathroom, we should take a look behind. Because if you take a look behind, you can see if there's any blood in your stool. Blood in your stool is never a normal thing. And so if you ever see blood in your stool, you should be evaluated by a physician. If you ever have blood in your urine, be it a male or a female, that can be an early detection of bladder cancer or kidney cancer. So blood is not normal, especially in a male. Why do I say especially in a male? Well, women have menstrual cycles, and depending upon your age, they can potentially see some blood in your urine. But a woman who has stopped menstruating, typically around the age of 50, you having vaginal bleeding or blood in your urine is not normal. We hear this all the time. So I'm a cancer doctor. What do? Is I take care of patients with typically advanced disease, and I manage treatment. I hear all the time, well, Mr. Jones, when did you first know something was going on? Well, last Thanksgiving, I noticed some blood in my urine. What did you do? Well, it went away. Then it came back in Christmas, but the grandkids were there and I didn't want to do anything about it. We hear this all the time. Blood is not a normal thing. So, prostate cancer. So unfortunately, there are no, quote, screening tests for bladder cancer or kidney cancer. What you can do, your doctor at least yearly should be checking a urine sample on you, and they can detect if you have any microscopic urine. Let's get back to colon cancer. So there is no clear screening tests or early detection beyond education of bladder and kidney cancer, but for colon cancer there is. So everyone's going to go, after today, they're going to turn around and make sure they don't see anything like that. Because I have a 6-year-old and I know he turns around, and everyone here should be looking around. Well, colon cancer is very important. We did that very thing, and a dear friend, as a result of our early detection program at First Baptist Church, got his first colonoscopy. And when he got his first colonoscopy, he found his colon cancer. And so he is now cured of the disease at this point in time. It's a wonderful thing that he did not need to see me and have to get any treatment from that perspective. Treatment beyond surgery. Colon cancer. Oh, important thing about colon cancer. So I turned 50 last year. And I was getting together with some friends, and we were talking about some health issues. And I said, Mike, so how did your colonoscopy turn out? He says, I don't need a colonoscopy. I said, you're 50 years old. You need a colonoscopy. Well, you should have had one at 45. He said, I didn't hear that. Well, many people in this room are African American, and African Americans should begin colorectal cancer screening at age 45. I believe in colonoscopies because they can look at the whole tract. There are some other tests, but the most, quote, difficult thing about a colonoscopy is the prep. You need to prep. You have to go to the bathroom and you get kind of clean your belly out. But you should be either doing that fecal occult testing, checking your stools, send it to your doctor. Colonoscopy, there's also a CT scan that you can get as well. But you should start, African Americans should start at age 45, 40 for prostate cancer early detection. For whites, it is age 50 for colon cancer screening, and for prostate cancer early detection, the same. If you have a family history, usually subtract 10 years. So, if you have a family member who was diagnosed at age 44, when I say family member, first degree relative, mom, dad, sister, brother, children. If they get diagnosed at age 36, you subtract 10 years. They get diagnosed, and whatever comes first. And so 45 for African Americans. Well, it happens. We don't know why, but African Americans tend to have colon cancer a little earlier, and you need to test for it. There's genetic testing, so if you have a strong family history in your family of cancer, I know Virginia Oncology, we have genetic testing. I know EVMS has genetic testing. That's important if you have a family history to get some genetic testing. It usually will be covered by most insurances from that perspective. Colon, lung, cervical cancer. So my dear mother-in-law is 86 years old. And I think the usual thing is when you go to the doctor, part of female health for many years was getting a female exam to look for cervical cancer. Above the age of 65, if you have had negative pap smears for 10 years prior to, you can stop getting screened for cervical cancer. Well, people like to feel good that, hey, I'm making sure, but the likelihood of someone getting cervical cancer if they've had negative pap smears 10 years prior and they're above the age of 65, that's one of the things that you can stop. It also depends upon When do you stop doing testing? Well, it depends upon how old you are, your other health issues. And so there's no right or wrong answer from that perspective. How am I doing on time here? 5 minutes. Let me just talk about the advances in cancer care briefly. So we've made lots of advancements in cancer care. For example, immunotherapy. Immunotherapy is different than chemotherapy. So when I decided to be a doctor and I decided not to be a cardiologist, I decided to be an oncologist. I'm a doctor who's trained who can safely administer chemotherapy. Now there are drugs called immunotherapy, which allows our immune system to work better. How it works is this: cancer cells have the ability to shut off our immune system. What these medicines do is block the immune system from being shut off, allowing our immune system to work. We've seen some very dramatic examples. I'm very proud to say that I was involved with a drug getting approved for bladder cancer, and I have a gentleman who has been seeing me for 2.5 years. He had advanced metastatic or stage 4 bladder cancer. The typical or median survival of that is about 9 months. And 2 years later, 2.5 years later, his most biggest inconvenience is that he has to drive from North Carolina every 3 weeks to see me, because now when we check pictures, we can't find any cancer. Is that the usual scenario? No. But do we see it? Absolutely yes. And so cancer care is we're making lots of advancements, and I'm a huge, big believer in clinical trials. If he had not participated in this clinical trial, he would not be alive today. But now, and the nice thing is, he gets free drug because it's on the clinical trial, and so he, like I said, his biggest inconvenience, he has to drive from North Carolina to here. Someone will ask me the question about proton therapy, because I always get asked the question about proton therapy. I referred them their very first patient, and so proton therapy is not a new treatment. Proton therapy has been around for many years. I'm going to close with this analogy. So I am a scientist. Is that my sign that I'm almost done? I am a scientist, and let me give you this analogy. If I was to take 100 people and ask them what's the best pizza, and I take 100 people who walk into Pizza Hut, and 91% of the people who walk into Pizza Hut say, that's the best pizza. This half of the room says, no, Dr. Fleming. This half of the room, 100 people over here, say, I like Papa John's. And 94% of the people who walked into Papa John's say it's the best pizza. Well, the people in the back, the 100 people who walked in the room, go to Cinello's Pizza. And of those people who went to Cinello's Pizza, 86% of the people said it's the best pizza. My question to you, based upon what I just told you, which is the best pizza? Ma'am, what would you say?
I like Domino's.
She likes Domino's. Could you tell me which one's the best pizza?
Papa John.
Papa John's. Well, that's what most people think, because they heard 94%. Well, you can't answer that question, because you took a biased group of people who walked into their Pizza Hut where they already went to. So I get the question all the time. It's about an hour-long conversation. I see lots of people with new diagnosis of prostate cancer. What's the best treatment? Well, we've never compared surgery versus standard radiation versus proton therapy. So it's the same analogy. So you can't compare different things unless you randomly choose. And then I get, Dr. Fleming, what is really, I know, what would you do for yourself? I would tell you the same thing. There's no best answer. They're all good options. And so I leave people with, instead of walking out of here, this is the best treatment, walking out of here with, you go out there, you have these options, go pick the best car, go pick a Lexus, go pick a Tesla. That's an inside joke. Or a Mercedes, and make your healthcare decision that you have very good options as opposed to what's the best option. Because usually there is not a, quote, best option unless there's been a clinical study to answer that. I'm going to close here and answer questions. Thank you.
Thank you, Dr. Fleming. Give everybody a round of applause. So, questions. I want to, we want to stay on time, so let's go ahead and start asking some questions. Let's start here first.
What about the camera pill? How does that help in diagnosing different diseases? The camera pill that you swallow.
Camera pill.
So the camera pill is typically used for, this is a typical scenario. So someone comes to me, they're anemic. We're trying to find the source of their bleeding because the most common cause of anemia in someone who's over the age of 50, 55 is some type of bleeding going on the gastrointestinal tract. The first test usually is a colonoscopy or an endoscopy, depending upon that type of bleeding. But if those are negative, we've seen the colon and we've seen the stomach, but we haven't seen the small intestines, or in this audience I can say we haven't seen the chitlins yet. And so the only way to see the chitlins, the small intestines, is to be able to do a small bowel, the camera where you swallow that. That's the typical scenario. And we don't have any, it's a difficult, only specialized centers can do actually taking a look inside the small intestines with an instrument. So that's the typical scenario where that is used.
Thank you. How can you do genetic testing when you have no brothers, sisters, or other living biological relatives?
Well, then the question I would ask, what would be the benefit of doing genetic testing? So my style is, if you do a test, what are you going to use with that information? Okay, so if we take a 70-year-old person who has no family relatives, we can do testing on that individual. There are some situation is very highly specific where it might be beneficial to know specifically for their cancer. We are able to do some genetic testing, or what we call genomic testing, when someone has an active cancer, and we can find out the best way to treat that active cancer. If someone wanted to do genetic testing on themselves and having no family members, and they were going to use that information, say for example, I'd be willing to go through a mastectomy, remove my breast or my ovaries if I have an aggressive cancer gene. That would be the situation we would do it. But I would think through that first before I do it, because it can have broad implications upon your insurance.
I got time for one last question.
I'd like to know if cranberry juice is a preventive for prostate cancer. Is it something that's beneficial?
I'm so mad at these technology guys, because I have a slide that deals exactly with that. And so I have a slide that looks at studies that looked over 30,000, 40,000 individuals in terms of drugs that have been shown to decrease the risk of prostate cancer. I have a slide that talks about pomegranate juice. There's a study of 48 men who drink 8 ounces of pomegranate juice a day, and it showed that when you do that, it decreases your PSA. It didn't say anything about preventing prostate cancer or treating prostate cancer, but as a result of that 48-person study, when I first came to town, I would say about 25% of my patients were taking some type of pomegranate or cranberry juice extract. And since I'm a scientist, until you show me a study that shows in humans that by taking cranberry juice that it decreases prostate cancer, I would say prostate cancer doesn't hurt. I would talk to your cardiologist, Dr. Newby, if he says it's fine for you to take cranberry juice. I wouldn't be against it, but I wouldn't be saying that it's preventing your prostate cancer.
Okay, we got one more here.
Dr. Perry, you did not address it, but would you address the issue of multiple myeloma?
Multiple myeloma is a cancer of the bone marrow. Our bodies, all of us make antibodies, and the cells that make antibodies in our bodies are called plasma cells. So multiple myeloma is a disease that is a bone marrow cancer or a leukemia-like cancer that in some situations is curable, typically with what we call a stem cell transplant, but is typically treated with multiple new agents that we have available. Multiple myeloma has changed dramatically since I've been an oncologist, that we're coming up with more and more advances from that perspective. So there are multiple new treatments. I usually start with people, are they transplant eligible or transplant ineligible? That means that how older you are and how many other medical issues that you have. Typically 70 is the cutoff for being a transplant candidate, and that's what's called a stem cell transplant. So how do you detect any type of blood cancers? It's usually through blood work. That's why it's important to see your primary care physician and trending out your blood work over a period of time.
All right, thank you very much. Thank you, Dr. Fleming.
Thank you.
All right, thank you, Dr. Fleming, again. And Dr. Fleming, if you can, before on your way out, young lady all the way in the back had one question, so if you could talk to her before she left. Thank you. Okay, next up, actually is, that's what I was waiting to see. My much older brother, Dr. James Newby is here, we won't talk about that. But anyway, he and his wife, Dr. Olivia Newby, are members of their practice, and they will be coming up to talk about diabetes. They have a healthy living center that they have been promoting, and it's all about, again, this aspect of prevention. And that is really the key to all of this, is how do we not just diagnose but prevent? And how do we deal with those complications? So we're hoping that we can detect things early enough, we can prevent the complication aspect. Everybody got that? All right. Now, did you enjoy the first talk? All right. Dr. Fleming and I are very good friends, so we talk a lot. Both of our children play together at times. We both go to the same church, so we've had the opportunity to get to know each other both professionally and personally for a number of years, so I really appreciate him coming out. So without further ado, my brother, Dr. James Newby, his wife, Dr. Olivia Newby, will come up and talk about diabetes.
All right, good morning, everyone. Good morning. Now, I'm going to do like we teachers do in school. Because a lot of what we do is visual in our talk, I'm going to need to ask everybody on this side of the room, if you please could move over this side of the room so you can see the screens better. You appreciate it better. All right, thank you for my indulgence with that. As my brother said, I'm Dr. James Newby, family practitioner and a certified diabetes educator. My wife, Dr. Olivia Newby, is a certified family nurse practitioner, a doctor of nursing practice, and also a certified diabetic educator. So we're going to kind of go into diabetes, its complications, and what's the outlook on treatment in the 21st century. Now, a little introduction. Everyone's heard the story of the Wizard of Oz. Dorothy was given these ruby slippers of the Wicked Witch of the East by Glinda, the Good Witch of the North. Now, during this story, Dorothy was trying to get to the Wizard of Oz so she could find her way back to Kansas. Now, when Dorothy finally got to see the wizard, none of his trickery or foolery and false wizardry could get her back home. Now, when Dorothy felt all was lost, Glinda, the Good Witch of the North, showed up and told her she had the answer all along how to get home. and the power was in her slippers, and all she had to do was click them 3 times to get home. Now, today's lecture will show you that most people with diabetes have ruby slippers, but they just don't know how to use them. All right. Okay, now according to the Centers of Disease Control, diabetes is about 29 million people with diabetes. It's the 7th leading cause of death in our country. It's the leading cause of kidney failure, stroke, heart disease, non-accident related lower limb amputations, and blindness. Now in Norfolk itself, where we are from, diabetes affects 10.5% of the population, and the rest of the country it affects 9.3%. So we actually have more diabetes in Norfolk than many other places in the country. Okay, now from the 2012 statistics of diabetes, African Americans comprise 13.2% of all the diabetes in the United States. Hispanic populations right behind us at 12.8%, Asian 9.0%, and white 7.6%. American Indian actually has more diabetes than all at 15.9%. Now in a study by the CDC that went from 2009 to 2012 showed that 37% of adults over age 20 had pre-diabetes, and over 51% of people over age 60 have pre-diabetes. So it's why there's so much diabetes starting to grow. Next. Okay, now worldwide with diabetes, it's also found to be really growing. In 1995, there were 135 million people with diabetes. In 2000, can't hear well? All right, thank you. In 2000, 171 million people had diabetes. In 2013, 32 million people worldwide had diabetes, and it's predicted at this rate of growth in 2035, 600 million people will have diabetes. Okay, now 80% of diabetes is being found in what we call developed countries. Countries that, have highways and apartment buildings and things of that nature. And it's also shown that the most people that develop diabetes in those areas are the disadvantaged, both economically and socially. Now there's a worse life expectancy. The earlier one develops diabetes. So the earlier you develop diabetes, the risk of more complications and trouble occurs. So what is contributing to this avalanche of worldwide diabetes? They really they see it mostly in what we call urbanization and technology. This leads to a sedentary lifestyle, and this sedentary lifestyle leads to people eating more, less active, and gaining weight, and all this leads to the complications in development of diabetes. It's also found that the Western diet, which consists of mostly meat and processed foods, are playing a huge part in the growth of diabetes. So basically, what is diabetes? Diabetes simply is a condition where the body does not process food properly for energy. Everything we eat is made for energy, so diabetes is a condition that just doesn't properly process that food. Okay, now there are several types of diabetes. I'm not going to go into great detail, just give you a little synopsis. Type 2 diabetes is the most common type of diabetes. About 85% of people have type 2 diabetes. That's where the body produces insulin, but the insulin tends to not work properly, it's defective, or the body's resistant to the insulin that's made. That's type 2 diabetes, the major type. Type 1 diabetes is where the body makes no insulin at all. So you have to have insulin just to live with that type of diabetes. Gestational diabetes is a type of diabetes that pregnant women get. They become pregnant, they develop diabetes, They deliver the baby, diabetes goes away. And the last type of diabetes is called latent autoimmune. In a nutshell, what it is, a person who has diabetes has type 2 diabetes, some changes over the years, the pancreas stops making insulin, and they become essentially a type 1. So those are the 4 types of recognized diabetes. One second, Keith. I'll let it go past here. Okay. So how do we diagnose diabetes? Basically, diabetes, fasting sugar overnight when you haven't eaten for at least 8 hours. If the figure is 126 or higher, that's diagnostic for diabetes. There's a test called an A1C test. If that number is 6.5 or higher, it's a diagnostic for diabetes. Now, pre-diabetes is where you're sort of in between not having diabetes but don't have all the clues and signs of diabetes. It can lead to a lot of similar problems that having diabetes, but it's not full-blown diabetes yet. So some of the basic symptoms of diabetes are excess thirst, frequent urination, some weight loss, tiredness, hunger, can be signs of diabetes developing. Now, most people, though, don't have any signs that they have diabetes, which makes it so difficult sometimes to pick up early or make you think something could be wrong. Just bear with me, this technology has me a little messed up here. I'm just going to have to use the screen. This is getting too hard. I'm going to just use this screen that I made all y'all move over here for. Okay, so why do we need to diagnose diabetes? Because of the complications. If diabetes caused no problems, really wouldn't worry with it. But because there are so many issues that develop, that's why diabetes is such a thing we have to find out about. Okay, so one of the bigger complications of diabetes is stroke and heart disease. This is a main killer with those that have diabetes. 65% of the cause of death in those with diabetes either comes from heart disease or stroke. Okay, kidney disease.
Come here, old man.
All right, yes, we got it now.
Totally got to help him out.
Okay, another complication is kidney disease. Basically, since diabetes affects the blood circulation, that's why it causes so many problems. So what happens with kidney disease, the arteries get damaged from diabetes, and thus the kidneys who depend on that blood become damaged. That's why you get heart disease, because the same condition affects the arteries that affect that. So with diabetes, it's the #1 cause of people with failed kidneys needing to go on dialysis. And just as a side note, you know what the #2 cause of kidney failure is? Hypertension. So you can see if you have both, that can really be a problem. All right. Next complications is what we call basically hardening of the arteries. Since I mentioned arteries is the issue, that's what tends to happen. Diabetes, because of the high insulin load that occurs and some of the resistance, the arteries get damaged and allow plaque buildup to occur. And that eventually leads to circulation trouble that can cause amputations and affect other areas of the body. And in this picture you may can see, go back, I'm not sure you can see that bottom picture, but that's someone whose circulation is so bad that the toes at the bottom are really dark. I'm not sure you can see it well, but that person more likely is going to lose those limbs. Okay, next area diabetes affects are the eyes, called a condition called diabetic retinopathy. It's when the vision of the eyes gets affected by diabetes, and that's that's the #1 eye disease that diabetes causes. And unfortunately, in the African American community, about 50% of people with diabetes develop this condition. Moving on, the nerve damage that diabetes can cause a condition called diabetic neuropathy. That's when it affects those nerve endings that go to your feet mostly. Can affect the hands, but typically in the feet you get these numbing, tingling sensations. They describe it as someone They don't feel like they're walking on their own feet. What this condition can do, it can lead to someone stepping on a tack or get a splinter in their foot, and they don't feel it. And the next thing you know, they get some kind of infection, develop abscesses, and can eventually lead to amputation if the damage is bad enough. Another thing diabetes can do, can cause sexual dysfunction, cause erectile dysfunction in men, and orgasmic dysfunction in women, because it's affecting those blood vessels. They are finding out some of the very first signs of heart disease can actually be erectile dysfunction in men because those blood vessels are getting blocked. And the same thing occurs down there, will occur up in your chest. Oh, technology just messed up again. All right, next condition is, can cause chronic dental disease. It can affect your teeth and cause all kinds of trouble that the dentist has difficulty handling because the sugar levels just affect those areas. All right, now moving on to some personal risk factors that can contribute to developing diabetes. The number one risk factor contributing to diabetes is called central obesity. It's where the stomach area that gets the largest from fat intake. It's the single highest risk factor. And in men, if the waistline is 40 inches or more, or women 35 inches or more, it really puts you up the ladder into possibly developing diabetes. Next thing is lack of activity. A sedentary lifestyle really increases your risk of developing diabetes. Find that exercise and activity burn off sugar calories, help to reduce weight, help prevent diabetes. Family history tends to run in families. There is a certain amount of predisposition if your family has diabetes. I don't know if you can see that picture well up there, but what do you think their risk of developing diabetes is going to be? Very high. Everyone is very overweight in that family. Okay, so what's the solution to controlling diabetes in the 21st century? Is it using more medications? No. Next. Is it having newer and better medications? No. Is it newer technology? No. Is it diet and lifestyle changes? Yes. Oh, y'all are ahead of the curve on me here. All right. Okay, at this section, Dr. Olivia Newby is going to take over and present a lot of the nutritional aspect.
How you all doing? I'm Olivia Newby. I am a family nurse practitioner with a doctorate of nursing practice, certified diabetes educator. Only 4% of us are African American in the United States. So hey, what am I going to talk about? Food. And how do you make this change? How do you make it just part of your everyday mantra, plan? Is what do you do? How do you fix it? What got me into becoming more focused on dietary, because I used to send my patients out to various places for diabetes education, and one of the questions I would ask them, and they came back just like I sent them. I'm like, something's wrong. What happened? What happened? I said, did you tell them you were putting fat back in them collard greens? Did you tell them you were eating some pig feet? Did you even tell them about the chitlins you have on the New Year's? No. Did you even discuss what you eat? No. So once I realized that they were not talking about what they were eating, how could we even approach how to change? How can we even approach for them to be in control of their healthy eating? So one of the tools we use, I am very much an advocate for, is portion control. You just cannot eat out of that 12 and 14 size plate. You need to eat out of that plate on the left hand side, not the one on the right hand side. Who is controlling my slides though? You. Oh, okay, so hey there. I'm gonna do the up, so when I'm ready for you to go. So let's go back to the very first one, because I jump all over the board from the slides, so they work. And so the next thing is nutrient knowledge. That's my, I tell you, my ladies, when you all out shopping and you see this dress in Nordstrom, you got to have, but one of the things we want to do is look at the price tag first, right? That's how you want to do when you go shopping for your food. You want to read that label and you want to look at that price tag. So that's how you, when we go forward, none of my diabetes patients with diabetes should and should not buy anything without reading that label. And the third thing is healthy diet. And there are a massive number of diets out there, but which one fits you? Which one I like to say is culturally tailored? In May 2016, in the Journal of Nurse Practitioner, which is an evidence-based journal for nurse practitioners, I published an article that was titled Culturally Tailored Type 2 Diabetes for African Americans in Group Visits. And why did I do that? Because I needed to culture your eating habits around what you do, not what I do. Okay? Now, ready? Portion size. We are often going to restaurants and you know when you get a plate and they got a little bit of food on there and you done paid a lot of money, you got issues, right? You want that plate full to the rim, you want every space covered. That is the place, not a plate you want to eat out of. So now we need to change your thinking. Don't always cover the plate. We want small is always better. You know that diamond? We want a small box. We want healthy yet small. You remember coming up when we had McDonald's? They see that old computer in the back? When McDonald's came about, we only had one size, and now you won't size it up. You won't, it's only 50 cents more if I supersize it. But you don't want that anymore, because I always say you eat it now, you're going to be visiting me later. Okay, so now let's look at this soda. Well, how many packs of sugar in there? I think that says 48 teaspoons of sugar, 800 calories. That's 8 miles walking and running. Okay, for every 100 calories, you need to be moving a mile. Tips to control: nobody eats that big hamburger though, right? Nobody. If you got a friend like that, leave them. Leave them. Don't hang with them. Because your money will be coming to me in the office. Oh, no, to me and Dr. Newby, okay? So when you all eat like that, you're going to be making more and more appointments, okay? So portion control, smaller plates. Why? And I say don't eat in front of the TV. Why not? Why not eat it? I don't want you eating in front of the TV. Because you just eat and eat and eat. And we call that in my world mindless eating. You know, you're really not hungry, but that coworker got a candy bar on her desk, you reach and get one. You know, you walk by, you wasn't even thinking about eating, but your friend or sister eating a bag of chips, you eat it. So it's called mindless eating, and not eating just mindlessly. Avoid all you can eat buffets. That's a no-brainer. You know you got to get as much as you can for that $20 or $15 you all have paid. You feel like you got to make Golden Corral pay for what you paid for. And you're not going to waste your money on a salad. You paid $10 and you're going to get meat after meat and meat, right? And that bread, you're going to get a bread. And some of y'all putting some in your pocketbook. Some of you putting it in a napkin. Some of y'all doing something else because you all going to make sure you got your money. Am I right? There you go. So you don't hang with them friends that want to go to the buffet after church now. No. Another visit to Dr. Newby and I. Another visit. Okay? Next. This is when I teach my diabetes class. Again, I'm going to promote my center. It's the Healthy Living Center, We teach you how to eat, and I even teach you how to cook for those who don't know how to cook healthy, how to make this plate. And I doubt half of us go out and fix our plates. Half of it vegetables, that's my first thing, 2 hands, and then 1 palm, 1 fist for the corner, which is your meat and your starch. Not 2 hands for the meat and the meat, okay? We tend to make meat our biggest item, but we want to change that. Vegetable. And I like to tell everybody this. How do you decide what to eat? So you want it to eat more things that don't have a mama, don't have a daddy, don't swim, don't jump, don't run, don't slither. You want the plant-based. I'm going to tell you all about that diet in a minute. So here we go back to this food label. In my diabetes classes, my Healthy Living Center classes, in my Healthy Living Center, we teach you about learning that label. You learn how many calories, what percentage of it is fat, cholesterol, carbs, if you're a diabetic, if you have high cholesterol, I teach you how to read that label. And if you have high blood pressure, I teach you how many milligrams of sodium and how to look for it. So that label, again, is your price tag. It is your everything. Simple carbs. What is simple carbs? These are nice words, words we try to figure out what do they mean. Do 3 pumps with that one. So I'm gonna put it all up at one time. All right, good job. Simple carbs, that's the stuff that just like it says, simple. Simple. Sugar, ice cream, processed food tend to be refined. Cookies, I like to say the things we like called taste good. Simple. That's right. So you want to avoid the simple things of life. You won't limit them. It's okay to have them every now and then, but simply leave them alone. Next. Now this is what you want. You want a complex person. Somebody gonna challenge you. You want some food that's complex. What does that mean? You want your whole grain. And you say that word whole grain, that means that when you go shopping, everything is marketed. When you buy that package, you look for that colorful package. You look for these buzzwords. Even on the cereal, they got a nice grain up there, say whole grain. So you want that word whole on everything you look for. And you remember we had to have that day, at least I'm brought up in South Carolina, we had grits every day. The cats were tired of grits, the dogs were tired of grits, we were tired of grits, but we ate grits every day. So it was a grain. So, but we also know for some northern, they love oatmeal. So that's a great choice for what we're looking for because it's a whole oat and it's a plant-based. As well as you want your sweet potatoes. We love sweet potatoes, but we put butter, sugar, everything else on that sweet potato. Okay? But it's a healthy whole grain food item. Fruits. Most of your fruits are where we should go. Corn and rice. I'm big on brown rice, whole grain rice. Rice is, and there are more and more rices out there. You have your quinoa and your, those are your, what I usually teach you is a super grain. It's the most powerful. It has all the nutrients. Because when I say the whole grain, it has not been refined to market because simple white rice has been processed. It's sweeter, it takes less time to cook, and plus we often use that. But if you have the opportunity, order whole grain rice, whole grain products. Watch your fats. We have the whole fat 2 pumps on that. Foods that are your fats we want to have is your monosaturated, polysaturated. Again, here's another opportunity we talk about to learn. I teach you how to learn which ones are your better fats. They have many, but you want to look for your monosaturated in terms of process, and you want to avoid anything, here we go, that's saturated fat. Anything that has your butter, animal. Lord, I don't know where that came from, but anyway, my mama watched her make those biscuits with that big water. Lord, I stopped eating it as soon as I saw her make it. But they taste good. So, but you want to limit that because it's the butter that makes it taste good. Oh, I hear y'all saying that bread with butter, okay? And you know what? It does taste good, but I'm not saying you can't have it. You can't get all those rolls y'all walking away from Golden Corral in your bag with. You know Aunt Sue always got to get a bag to take home when she go. Examples of good oil: olive oil, mono, canola oil, next best, peanut oil, and vegetable oil. Here we go, better choices. I'm not saying you can't have it, I just say limit it and make the better choices of your oils. Next, bad oils. That's your coconut oil. How often I meet people buying coconut oil all the time because it is marketed as good for you, but it is a higher saturated fat. So you want to leave away palm oil in your lard and bacon grease. How many of you all, don't raise your hand, but in your mind raise your hand. Don't put your hands up at all, but you all like a little bit of that bacon grease in your good old collard greens and your good old cabbage. Leave it alone. Leave it alone. All those complications Dr. Newby talked about, this is what clogs it up. These things here. Whole grains, I already talked about it. Whole grains, whole grains, whole grains. Healthy, has all the B vitamins, is the one that gives you energy. So I always pack my sandwiches and my food with whole grain for whatever it is, to look for that nutritional value. And choose good meats. You have your chicken and going with 1 pump. There you go, whole. Turkey, fish, go back, 2 rounds, go back. Turkey, fish, lean chicken or beef, pork. So here we go, chicken not fried. We all know those pretty much. So salmon is up, not there, but I will always like to add that in for my fat content, a healthy fat, your salmon in that sense. You have, but bad fat, I don't even have to mention it. What's some bad fats without even pulling the answers up? Pig feet. Chitlins, bacon, all them bad meats with all the fat on there. But one of the things, even my class, Tuesday, Thursday, whatever the class, it's just trying to get us away from cooking our vegetables without that animal fat. It's hard. Go. There we go. Pig feet, number 1, tail. No, they're not telling no diabetes educator that nice building you eating them pig feet. No. Hot dogs. How many of y'all like hot dogs? That's a bad one. Yeah, you like kidding? We just ate a whole bunch of it at such and such cookout and birthday party. Hamburgers, pork or beef sausage and bologna. If it's not an animal, don't eat it. There's no animal called hot dog. There's no animal called bologna. There's no animal called none of those. So, don't eat it. Don't eat it. Bologna, my mother's 92. Trying to convince her of this menu, forget it. I've given up. You know where you can work and know where you can. She had 3 slices of that bologna and just said, I'm going to eat it. Okay, go ahead, mama. You're all right. She's 92 and won't use a cane, so whatever. All right, next. Reduce salt. One of the things is typically we have a traditional ordinary diet of sodium. We consume 3,500 milligrams of sodium, but it is recommended at 2,300, which is a teaspoon of sodium. And if you have any of those diseases we're talking about today, we only say you're supposed to get 1,500. So what I always advocate and adamant about everybody who's in my classes and any that come through my program, you read that label because it will tell you how much sodium in there. We even take time going through everything they've eaten and saying how much sodium, because then you want to know why your legs swelling, why you this and why you that. I'm going to give you your answer right there in that package. So reading that label and looking at the salt. Next. Is sea salt better than regular salt? There you go. See, you already been through my class. Salt is salt. Seasoned salt, BAM salt, everybody got a name. Salt is salt. Salt is salt. What it is though, through my recent program,
They talked about the different kinds of salt. There are better quality salts. What it is to have a stronger affinity of it, much stronger. You don't use as much of it. So with that regular salt we buy at the grocery store, you have to get that sodium taste, you tend to use more of it. You know how you start shaking this salt? But if we buy a better salt, you don't use nearly as much. So that's kind of where the gray line. But salt is salt, okay? Because that's one of our big things. We love salt. Here's my labels and understanding food labels. And at the bottom of it, it tells you the breakdown of that label. One of the things is I teach them how to look at it, because corporate is trying to make a profit. So if that package is pretty, you know, you all pick out that package and decide by the packet. And a lot of times they'll say if it's fat-free, and we would often say that has to be better. But once you learn how to read that label, you can identify for whatever problem you have, regardless if it being overweight, hypertension, high cholesterol, you are able to distinguish that from learning to read that label. Bologna, oh yeah, there you go, bologna. Yeah, because you all love to fry it up, put a little cheese on it, and a sandwich. You had that as what y'all have it as, a little lunch? Little lunch on there? It ain't gonna be, I didn't have a little bit, right? Isn't that what we say? Okay, so just for those who just had bologna, a sandwich yesterday or last week, we want to tell you if you have high blood pressure, your sodium content for one slice is, this one is 400, let's go with 500, because I know y'all had 2 slices, because y'all did not have that thin one slice. You know good well you did not have that one slice. Everybody put 2. So you added 800, half a teaspoon of salt. There you go. That's why your legs swelling. That's why you got more visits. That's why. That's simple bologna. Okay? All right, what else? My hot dogs. I love hot dogs. You're going to get 2 of them at the cookout. All right? So I even put y'all name brand. Y'all like name brand. Who is that? Oscar Mayer. Oh, and it's a beef dog. Beef dog. Okay. So that one is $740 for one little hot dog. Yes, you got my point? Come to my classes, Healthy Living Center. We talk all about what you're eating. Actually, that's one hot dog is 700 milligrams of sodium, and more or less that fat content. Why we trying not to be overweight, why we trying to lose these calories, is the fat content. And what is it? It's you buy, I don't know where the animal hot dog come from. What's one of them animals walking, crawling, and slithering, something, right? I have no idea, but it didn't grow out of the ground, so that's my point. Going to the next one. This is what I talk about, the diet for diabetes health, but forget that leading counter, diabetes health. It is the diet for healthy living. Healthy living, plant-based and Mediterranean diet. Those are the 2 times what we want to look at. Let's go. We got 2 pictures up there. Statistics and evidence-based have shown that the Mediterranean and the plant-based have shown improvement and reverse certain cancers, because again, it talks about and promote more and healthy eating. And the plant-based, just as it is, it talks about eating more plant, because we know those are the things that have less fat contents and it's not processed. And my time is moving, so plant-based is where we really promote again. And next, your diet goals is to eat more and less meat, more vegetables. And Dr. Newby gonna finish up with the contents of what we do to make your health good. Okay, thank you.
Just have a few quick wisdom and knowledge equal good health. Next. Okay, one Bible quote comes from Proverbs 4:7, says, "Wisdom is supreme, therefore get wisdom, though it costs all you have, get understanding." And Proverbs 1:5 says, let the wise listen and add to their learning, and let the discerning get guidance. And there's one other quote from Thomas Edison back in 1800, says, the doctor of the future will give no medicine, but will involve the patient in the proper use of food, fresh air, and exercise. It's amazing how we're coming right back around to that now. So conclusions, diabetes has become a menace to society, especially to the Black and Hispanic community. Diabetes causes and contributes to many other medical conditions. 21st century solution to the ultimate control and prevention of diabetes is a healthy lifestyle and plant-based dietary habits. And as in the Wizard of Oz, your ruby slippers are your plant-based diet and healthy lifestyle. Just to let you know, our Healthy Living Center Foundation sponsored this talk, and we actually have classes and community and programs that we mentioned. We have written a book called I Have Diabetes, Now What? And any of you actually interested, I have a few copies, only $10, and we have time for questions now.
Is there a way you can calculate your A1C without going to get the blood test?
Theoretically it is, but you would have to test your sugar several times every day for 3 months. And there's a formula that sort of matches that, but it's very difficult.
Yeah, Ms. Olivia, I just have a question about your program. Is it just for diabetics? Because I have a young lady that I work with, trying to get her to manage her weight. She's currently like 270 pounds, and the insurance company, I asked for a nutritional consult for her, and they won't pay it because they said she's not a diabetic. So I'm looking for some type of, a program or something in the community that I can help her get the resources that she needs to help her better her lifestyle.
Perfect question. Actually, that is why I became the advocate for the Healthy Living Center, because it's just so many questions, so many people. We just lack that understanding, and marketing has just given us a false sense of how to manage within this. And my administrator, she has all the programs. I had my first class that was open to the public to come in, and I show you how to cook with herbs, which we may not be accustomed to. We use butter and fat and all those things to season. I teach you how to use your herbs, your basil, your rosemary, thyme, and things that you grow. How do you take your celery and to make it pop? How do you make the food you have in your house hot with seasoning? Because Thursday's class, we cooked cabbage, and all of them cooked cabbage with animal food. And I teach you and let you taste how you can make it pop and taste snap good. My administrator right here, she can tell you all the programs, the program off, and I'm not gonna miss my plug of, sorry Brother Keith, my health fair, which we will have a chef come in, Dr. Newbyhot, and my brother-in-law, we will be talking about specifically diet, healthy eating, and all of this. And Ms. Ela, my administrator, have the flyer from that, and we again will show you the Healthy Living Center. And yes.
Yes, I have diabetic and arthritic neuropathy in my hip and in my leg and my thigh, and it has caused damage to the muscle and to the nerve of the side. It makes me hard to walk on. But it seems like it's poor circulation in his leg. It just stays stiff all the time. I get up, especially when I get up in the morning. Once I get going, I can keep, I keep going, but it just stays stiff. And when I get up out of the bed in the morning, that's when I thought it should be better. But also, the doctor told me that there's nothing they can do for it, and that it'll take, it'll heal itself in about a year. Yeah.
So what was your question? Or just like more of a comment?
No, I wanted to know about the healing.
Okay. Well, I'll talk to him about it, just so we can keep moving out. You and I have that conversation.
With regards to the medical and clinical aspect,
Are you participating in anything like exercise, the chair exercises?
Yes, yes.
Those can be positive roles to promote healing as well as the weight loss on the hip and the exercise. In our Healthy Living Center, we do chair exercise. I run a diabetes prevention program sponsored by the CDC, which I am a CDC lifestyle coach. And we promote, and patients have literally lost weight and do those chair exercises. And we will have those exercising people next week to even further garner your improvement.
Okay, next question.
Good afternoon, Dr. and Dr. Newby. I have a comment and then a question as far as medical relationship happens to be concerned. But Dr. Newby, you stated that your mother was 92, correct? Maybe, do you think it would be helpful if you could put something together to show how she actually got to 92?
Research, there's no clear-cut relationship between the two, although a lot of diabetics have glaucoma, but from my research, there's not a direct connection like there is with the retinopathy.
Oh.
I have time for one more question.
Good afternoon, Dr. Newbies. Question for you. Once diabetes is developed, is it reversible or at best it's manageable?
That's always a difficult question because it can be reversed. A lot of it depends on if it's related to weight. A lot of times it will be reversed if you can get down to a certain weight where your body is back in balance and your A1C drops below 5, and you just have to say, well, the diabetes is gone. There's some gastric bypass surgery that seem to have cured diabetes for one reason or another. Most, though, I don't tell people don't be so bent on getting rid of it. If you can control it to the point that you don't even need medicine and everything is eating and exercising and things of that nature, that's pretty good. There's too many things you just can't change in our lifestyle after so many years that can really lend itself to getting rid of it 100%.
All right, well, thank you all very much. I appreciate it. Give everybody a round of applause for that excellent discussion. Thank you very much.
I will have the flyers for our health fair outside, so I won't delay, and we will welcome you. Get a chance to see my great brother-in-law speak again as well, but we're going to talk more about that evening, okay?
Thank you very much. Listen, so I wanted to make a quick announcement too before we move on to the next discussion. We have some nurses who volunteered with Centera who are out front. I had to move from the other building out here just to make it a little easier for your walk, who will be screening for hypertension. Now, part of the reason why I'm emphasizing this point, and we're talking about diabetes and hypertension and some of these other chronic illnesses, is mostly because most of these are undetectable in terms of symptoms. So in other words, most people are asymptomatic, they don't feel anything, and that's the danger of this diagnosis, or both of these chronic illnesses, is that most people feel nothing. You really think about it. Most of you that may be diabetic or have hypertension, you probably never even knew you had it until somebody checked something and you found out you did. And it's the rare person that actually has massive symptoms that were earlier described. Most people, when you start thinking about it, especially the pre-diabetics, feel nothing. If you look at the data, it says that people who are pre-diabetic have the same risk as a full-blown diabetic to develop heart problems. So it's really important that you make sure you identify and the only way you can do that is you have to go see your doctor. So please do not take that hesitation approach that was described earlier, because again, I like living, so I'm hoping you do too. And the only way to do that is you have to make sure you identify those problems that otherwise may take you away from here. So I'm going to ask you, make sure you're seeing your physician. So we're going to move on to the next discussion, but I wanted to ask this. Nurses that are out front, just periodically, if you guys could walk out there, get your blood pressure checked while you're here. Just make sure, they'll be here till 3 o'clock. Just make sure, that you walk out there, let them check it, make sure you know what it is. It's going to be important. The reason why I say this is because oftentimes you go to your doctors, you're going to be a little nervous probably going in. Pressure may be a little high, because you're at your doctor's office. I want to catch you when you're nice and relaxed. You're hearing, I don't know, you may get depressed after hearing all this stuff we've been talking about. But my hope is that you would go out there, let them check your pressure, see what it is, come on back, so at least you'll know what your blood pressure is running, so you can make further adjustments in your lifestyle. Or get to your doctor, and if you don't have a doctor, get one. That's the whole point of all this. So moving right along, next up would be, we're going to discuss caring for the elderly population. And we have several speakers for this. So Ms. James, you out here? Oh, okay. So I'm going to start off with her and let her tell me exactly the order in which she'd like to have everyone else talk. What we're going to do, this is going to be like a 5 or 10 minute discussion on each point. What we're looking to try to do is find the resources that are available. And although this may apply to you, may not apply to you, may apply to a family member. The whole point of this is so you understand the points that are important, to know what's available out there, what's the legality of having somebody look out for your best interest from a standpoint of health care decisions. And you need to know what it impacts, when these power of attorneys are good, no good, what do they really mean? What are the resources available to allow you the opportunity to get out and enjoy life, but at the same time be protected, so you can have assistance if you need to. So without further ado, the first speaker will be Iris James, who's with Senior Services.
Good afternoon. I'm Iris James, Community Outreach Representative for Senior Services of Southeastern Virginia, where we help seniors to live with choice and dignity in their community. In addition, we work with their families, their caregivers, and anyone in their church, their neighborhood, their civic group. It doesn't matter. We want them to be healthy and happy where they are. So we have with us today several individuals who are going to give you little snippets of information that will give you some resource options for yourself as a senior, for your family members, and anyone in your community. We have individuals who are going to talk about some legal aspects, some caregiving aspects, and show of hands, who has done their advanced care directive? Put them up. So Ms. Shamika is going to have a little bit of work to do to convince everybody that anyone 18 or older needs to have that document in hand. I'm here representing Senior Services of Southeastern Virginia, which is the area agency on aging. We serve seniors 60 and older. We provide transportation services. Who's seen our iRide buses on the street? Anyone had an opportunity to use those or use them for their family members? Show of hands. Okay, so I have flyers out front. I've had many inquiries today regarding our transportation services. This is not Handy Ride, but you just pick up the telephone, you call our offices, and you talk to a transportation counselor. They can get you registered, and then you call back when you have a physician's appointment, any medical appointment in Southampton Roads, and in Western Tidewater our services act a little bit differently. But if you call our office, the transportation counselor can try to help you to get to your medical appointments. Doesn't matter whether it's chemotherapy, a regular physician appointment, it could be dental or eye, or even for dialysis. So give us a call for transportation. Who's familiar with Meals on Wheels? So we are a part of the National Meals on Wheels program, but our program that we have that operates out of our office is a little different. We have the Home Delivered Meals program, and so our options counselors can work with individuals who may be homebound, who may be having a problem cooking, or sometimes people just need temporary assistance to make sure that they're getting nutritious meals in their home or in their location. Even sometimes if you're staying in a family member's home, it may be beneficial to have these meals delivered. So we also have wellness programs, exercise, our new enhanced fitness program, which is done throughout the community. Sometimes in churches, our Matter of Balance programs, sometimes we bring them to the churches or community centers so that people can work out and learn about health and nutrition where they are on a regular basis. Socialization is very important, and it doesn't mean going to a senior center and sitting and playing dominoes and bingo all day. There are other activities out there that we can participate in. We have a lot of active older adults that we work with in the communities, and we want to provide programs and services for them. Nursing home care, home health aides, home health care companies, we are the resource to help individuals and families connect to these services. So we don't have all of the programs and services in-house. Many of the services that we provide have no charge attached to them. We can do that because we get some funding from the federal government through the Older Americans Act, through the state, through the Department of Aging and Rehab Services, and also from local corporations or foundations and individuals such as ourselves. So we gladly accept donations at any time so that we can help those seniors who may be less fortunate to get some of the services that they desperately need in their home. We can connect you to resources such as Social Services Department, and what about Medicare and Medicaid? And who knows when open enrollment is this year? Anybody? Show of hands. Open enrollment. What are the dates? Shout it out. October until when? Very good. So stay aware of that fact. Don't let the dates pass you by. We have benefit counselors on staff at no cost. They are not insurance agents who can assist those individuals with Medicare, no matter your age, with Medicare to get through that Medicare maze, to review your drug plan, to make sure that the dollars that you are spending on health care are benefiting you, and that you're not just paying for services or paying for medications that you either don't need or paying a higher cost than what you have to pay. Yes. We are located in Norfolk in the old Coger Executive Center, now known as the Interstate Commerce Center. That place is right off of Newtown Road and Kempsville Road, about 2 blocks from Centera Lee Hospital. That is our main office, but we have satellite offices throughout Southampton Roads and Western Tidewater. We go from the ocean, from the Atlantic Ocean, all the way out to the Emporia line. So we're available. It's one number. Make that phone call, call us, talk about any resources that you think you or a family member or someone in your community may need. We are open to have those discussions. Other questions?
What is that telephone number?
That phone number is 757-461-9481. And if you can't remember that, some people in here will remember with the old CVAM office, it's the same program. The number hasn't changed, 757-461-9481. All of our brochures have that number on the back. And once I come out and talk to a group of individuals about who we are, where we're located, and what services we have, you are now considered ambassadors for Senior Services of Southeastern Virginia. Pick up a brochure, keep it in your pocket, put it in your purse, and then whenever you're having a conversation with someone who's having a problem with their Medicare, getting their medications, a senior or someone in the family who needs to get connected to Alzheimer's Association or even to a physician's program, physician's office, you can give us a phone call. We have people, our resource counselors, who are available to have that conversation with you.
And Ms. James will be here for the duration. Okay, so we want to thank her for coming out, spend a couple minutes describing the senior services, and we want to go ahead and keep moving, but she will be here, so I want to make sure you know she has resources out in the front in the expo area, so that if you want to grab something on your way out or to go out there and just have a conversation with her, she'll be out there to receive you all. So thank you very much for that. Next will be Kendra Johnson, who's an attorney here in the area, and she's going to come up and discuss some of the legal aspects of as we get a little older, and I'm being careful with that terminology, but I want to make sure that she has her ability to discuss some of the important aspects that you need to know.
Thank you, Dr. Newby. Good afternoon, everyone. I hope you guys are enjoying this afternoon and we're not boring you or making you fall asleep out there. So I'm going to try to be engaging with my presentation today. I just wanted to talk to you guys a little bit about some of the options. And the options that I have available for you guys are wills, powers of attorneys, and I'm going to touch briefly on advanced medical directives, but I'm going to let Ms. Butler finish talking to you guys about those. So one of the main things that we battle against in life, and if we're just honest, everybody loves a good story, right? Every story has a hero and a villain. And sometimes in life, the subtle villain that we run up against is time. Nobody knows how much time they have to live on this earth, and at any moment your time can be shortened or your life can change. What I want to talk to you guys about are the legal options of planning for any type of change that can happen either by death or by incapacity. So the first area I'm going to talk to you guys today about is wills, and then the second one I'm going to talk to you guys about is power of attorneys, and the third one I'm going to talk to you about is an advanced medical directive and what each of those documents are. How many of you guys already have a will drafted? By show of hands. Okay. So a will sets up the way that you want your property to be distributed after your death. If you don't have a will, I want to talk a little bit about what that looks like, just so you understand the importance of having a will document drafted, and also that your will is tailored to have your property distributed exactly how you want. Now, if you don't have a will in the state of Virginia, then there's something called intestate succession. And if you don't have a will, there are people automatically in place who are lined up to get your property, and people who you may not want to get the property the way it is. For example, if you're married and it's not your first marriage, say it's your second marriage, and you have children from your first marriage, you may want your spouse to get everything after you pass. But if you don't have a will in place, the way the Virginia law is set up, you would have your spouse get 1/3 of your property, while your surviving children would get the other 2/3. So that's why it's very important, if you do have a spouse and you want your spouse to have everything and it's your second marriage, that you have a will in place specifying that that's the person you want to have that property. When we discuss wills, there are some terminology that I want you guys to be familiar with. So if you speak to an attorney about it, or if you're talking to someone about it, I want you to know this terminology. The first bit of terminology I'm going to explain to you guys is a testator. A testator or a testatrix is the person who is writing the will and on whose behalf the will is being written. And then the executor, executrix, is the person who is going to execute the will on your behalf. So this is going to be someone who you trust to be able to distribute your property after you pass. And you want to make sure when you're picking this person, it's someone who knows how to locate the property, that you speak with them beforehand, so they know once you pass how to get the property to the beneficiary, which is the person who you want the property to go to. Another aspect with wills is sometimes we get in these situations after we pass, and I'm sure some of you have had these things happen, where everything's fine with your siblings, before the parents pass. But then suddenly when the parent passes, there's this huge fight about the property. Well, if you tailor your language in a will, you can actually tailor your language such that if anyone starts to fight like that, they'll get disinherited. You can do things like that with your will, just to prevent people from making a big fuss about things after you pass. So those are some options available to you with your will. The next document I want to talk to you just briefly about is something called a power of attorney. Now, power of attorney documents is a document that you use for, you can either use it for your incapacity or you could just have it effective until you're incapacitated. There are lots of reasons why a power of attorney comes into play. A simple situation, and I think we often think of it when we're getting on in age, but think of it in another way. Say you're driving one day and somebody rams into the side of your car and you lose consciousness and you don't regain consciousness for a few days. Who's going to manage your affairs? Who's going to make sure that things are taken care of on your behalf? That's a simple moment where incapacity can happen that we don't often think about, which is why it's so important to have a document in place just in case something like that happens. Now, a power of attorney can be general, meaning it's very broad and it can grant lots of powers, going to court on your behalf, the person can sell property on your behalf, they can do a lot of things. Or it can be limited, and the limit can be in scope and in duration. In scope meaning in what they can do, in duration meaning in how long it takes effect. For example, one that people don't often think about for a power of attorney is if you're a parent who's leaving the country and your minor child needs someone to take care of them. You could do a power of attorney for that type of instance as well. And then there's also the power of attorney that is only takes effect upon your incapacity. So you can tailor this document in many different ways, but it's very important to have, because if you have that situation occur where you are unable to make decisions on your behalf and something happens, then you need someone who you trust, and that person's called an agent, to be able to make those decisions for you. And the third area that I'm going to discuss just briefly is an advanced medical directive. Now, you can have a medical power of attorney, which allows someone to act in regard to medical decisions if you're incapacitated. And then there's an advanced medical directive, and I think Shamika is going to get a little bit more into the differences between the two of those, so I'm not going to touch on it too much. But I do want to talk about what the process looks like if you don't have these documents in place. Now, if you don't have a power of attorney in place, what's going to happen is your children are going to have to try to petition the court to get guardianship over you. And it doesn't even have to be your children. If you become incapacitated without one of these documents in place, it says under Virginia law that any person can petition the court to be your guardian. And if you don't want that type of fight happening between your family members, it's probably better just go ahead and appoint who you would like to be an agent to act on your behalf in advance. I think the main thing that underlies all of these documents is planning to prevent fights. You want to make sure that when something happens, you know exactly who will be taking care of you and how they will be taking care of you. So I'll let Shamika get a little bit more into the advanced medical directives and petitions. I can discuss a little bit more about petitions for guardianship and the panel if you guys want to ask questions about that and what that process looks like. Or if you have someone who's struggling with their capacity right now, the type of process that you would have to go through to try to petition the court essentially to get to be able to be their guardian, to help them make those type of decisions. So if you guys have any questions, I can answer those questions for you now. If you have any questions about the legal aspects of it, or I can't answer specific like case by case scenarios, but general questions I can answer.
And I think it's extremely important, just as a physician, I can tell you just personal firsthand, dealing with people that are in that situation where the family member may have made a comment about what their wants and desires are, but they never had it physically in writing. And then you get family members that sometimes don't want to necessarily agree, and I'm being very diplomatic when I say it this way, but it can be interesting dealing with family dynamics. And I've seen it break up families, tear them apart, because unfortunately sometimes people cannot separate their emotional side from the side of doing what's in the best interest of their loved one. And I know it's difficult. I know firsthand it is. So it's important that that happens. So I just wanted to throw that in there to say it's nothing worse than seeing a family tear itself apart because that document was not in place. But questions? I think I saw a hand over here.
Can you explain last will and testament?
Yes. So the last will and testament is the document that governs your property, your assets. There are certain things that don't fit within that, like for example, if you have a life insurance policy, there's already a beneficiary set up under that document. Same thing with your retirement plan. There's like a beneficiary in that plan. But the last will and testament governs any property that you have. So if you own a home, if you own a car, if there are items within your home that you want to go to specific individuals, those are the type of items that would be governed by a last will and testament. And that document, it would be drafted by the individual who owns the property, and you would just state in your document, and you would list your name, being of sound mind, hereby I leave whatever properties to, and you would name the individuals. And you'd also, within that document, name someone who would be responsible for giving the items that you're leaving to the other person.
Any other questions?
Can I just ask, does that also cover something like 401k or something like that? That's not physical property, but that's...
No, a 401k, with any kind of contractual document, something like a 401k, you have to look at how it passes under the document. So if it's like a 401k, if it's a particular plan, that plan typically says how a beneficiary is set up, and your will won't touch that. So you could say, I want the stuff in my 401k or my life insurance plan to go to someone, but unless it's in that plan, it won't work. So you need to make sure that those documents stay separate. The will talks about your specific property, like your bank accounts, as long as it's not like a payable on death account. If it's just that asset, you can leave the funds within that bank account to a person.
Okay. And she will be staying for a little bit after this, so if you have any questions that we're not able to do, because I only have time for one more. And first takers on one more question. Okay.
Do these documents have to be notarized?
Yes. So the notary is best to have, because a notary is someone who will swear that you are the person who signed the document. A notary will have a sworn statement stating that you were of capacity. Technically, you can get away with a will without it, but then your will can get challenged. The purpose of making sure that you get a will notarized and with the proper witnesses, which is why I usually recommend people at least get an attorney to look over it, is so that it doesn't get challenged and it can do what you want it to do after your death. Because once you're gone, you can't come back and change the language in that. You want to make sure that it's ready to go and that everything that you desired for your estate happens when you pass.
All right, well, thank you very much. Again, it's Ms. Kendra Johnson, and she will be available for a few minutes after we're all done. So we're going to keep moving with Dr. Barbara Harrison, who will come up and be the next presenter. Got that? Okay.
Good afternoon, everyone. How are you? Pleasure to see you this afternoon. I have the privilege to represent a wonderful community partner organization. It's called Kids, Kin, and Caregivers, and I'm a member of the board of directors of that organization. So we are partners with a lot of community-based resources, and what I want to say about the organization is that, as what Ms. Iris says, there are a lot of organizations out there that sometimes you know nothing about. We have a particular focus where we work with our organization on children and their families. But we particularly have a desire to be of assistance with grandparents who are working to raise children. You know, the things that we can do to assist this family and the support systems to stay intact. We also have dedicated programs in our organizations where we can work with people who are becoming caregivers and are experiencing the caregiving process, where we can do coaching so that you kind of get the feel for how the process goes. And I just want to take a moment to say to those of us who have been caregivers and those of us who are caregivers now, and people who will care for others in the future. It's really okay to ask for other people to help you. You know, some of us have the sense that, you know, we're competent people and we can do it all ourselves. But you know, we're on this earth together, and nobody knows the answers to all the questions. Community partners, we work together. If we have a question about an advance directive, we call a person such as Ms. Butler. If we don't know what's going on, we call Ms. Iris if we have a concern about seniors. Or if someone is concerned about being a grandparent and you know, getting those tips now that you've got a new set of kids that you're working with. You know, you haven't done home safety checks in a while. You're thinking, when your little people were little, now we have a whole other set of groups. We've got to be safe on the internet. You know, so there are people to help you. You know, when you start feeling grumpy and maybe you're getting irritable and you just say, you know, I'm not going to things that you enjoy, that can be a sign that you may be feeling stress from being a caregiver. You know, take care of your own self. You know, we're a viable network. If my organization, and I feel very honored to represent them, if we can't help you and we don't know who to, we talk to other groups, to other people. So, you know, nobody has the answers to everything, but all of us are committed to the process. And, you know, we Google, we look, we phone, we call, we talk to other people, just to get people what they need. There's a lot out there. People are entitled to the resources. Sometimes you don't know what you don't know, and you don't even know that you were eligible to know it. But you talk to me, you might have said, oh my goodness, I got all these grandkids. What am I gonna do? Well, Miss Iris might not have that as her dedicated focus with her organization, but she knows that, you know, Harrison talked about, you know, kid and kins and families. Let's see what they can do. So I want you to think about it in that kind of context. We're all in this together. And it's okay. You know, remember that when you caregive, you don't have to know everything in the world. And, you know, you ask. And you don't have to do everything. Let people help you. Might not be the exact way you wash your dishes. You know, and some of us have some issues about that. Some of us wash our plates and then we wash our silverware, and some of us dump everything in the sink. You know, the bigger piece is, are the dishes washed and can we eat off of them? You know, I could come over to your house if you need help and be there while you take a rest. Doesn't mean you're a bad provider, it just means I'm trying to help you. And as a caregiver, it's an issue of my own heart is people who try to help you don't know what you need unless they're psychic, I guess. You have to tell us. You know, I just need you to come over and be in the house and be with mama or whatever it is you need while I take a bath and take a 30-minute nap. So I speak on behalf of my organization. We're called Kids, Kin, and Caregiving. We're local. We're on Virginia Beach Boulevard. We're just down from Military Circle, and we have a very distinct building. The outside of our building is painted turquoise color. So if you're coming from Military Circle, heading down to Pembroke Mall, there's a bunch of car dealers there, and then you look over on your left, there's a turquoise building. Come see us, come call us, we'd be happy to help you.
All right, thank you very much. Thank you very much, Dr. Harrison. So let's go ahead, without further ado, Ms. Butler, you come on up, please. Thank you.
Hello, y'all. I have to hold the mic. So, hi, my name is Shamika Butler. I am a clinical social worker by trade, but I'm also a community ambassador for the Advanced Care Planning Coalition, As You Wish. With this particular organization, the purpose of it is to promote advanced care planning within the community. We do see issues when people, they are afraid to do their advanced directives because they don't like to talk about death or they feel that they are immortal. So the purpose of this is to encourage you to know that you have ambassadors such as myself and others who are in the community, that we are here with you to help you out with this decision making. And I just really like to promote this organization and the purpose of it because I'll speak a little about myself. I am 27 years old, but I do have an advanced directive. I've had it since I was about 25 years old, because the way I like to say is that you really don't know people the way you feel you may know them. And I don't say this as, to put your family members down, your friends down, but when situations occur involving your health care, you really don't know what a person may feel that will be best for your care. So they may feel that they want to prolong treatment and they may want to intubate you, or they may feel that they want to prolong your health, but you've never had that conversation to say, I don't want this to be done. I don't want, this is not a quality of life for me. I don't see myself being on a ventilator for the remainder of my life. So this is why I, try to, especially within the millennials, I try to encourage them to do the advanced directives, because being a medical social worker, I do see it every day between individuals who are in their 20s up to the ages of 102, and they do not have advanced directives, and if you don't, you're automatically seen as a full code. So with being a full code, the medical team, they're going to do all they can to prolong your life until it gets to a point that ethical dilemmas do come apart, and that starts involving others in your care, that you may not want that many people who are strangers being a decision making of your care, and it makes issues between your family. Did I turn it off? Hello? Okay. And it just causes a lot of issues. So as I said, it's just, we try to promote this because, and you have the right to write your advanced directives any way you want. For example, I do know one individual, she typed her whole advanced directive out herself, what she may want in certain instances. Say if she was in a car accident, she may have been diagnosed with cancer, if she was given a certain amount of time to live, you do have the right to do that. If you do not feel that you want to do it, we do have pamphlets that kind of guide you and help you out, and you just fill in the blanks. But like I said, you do have the right to make that decision because that is your life. And you know what's best for your life because you know yourself better than anyone else would know. You think people know you or you think you know someone, but you never know until situations occur and what could possibly happen. So that's about all I have to say. I'm not big on speaking in front of crowds, but if you would like to, ask me any questions or anything like that, please feel free to come talk to me. I'll answer any questions for you.
All right, well, she will be, and the whole group will be out there in the expo area, and we want to appreciate Ms. Butler for her wonderful words, even though she says she's not a speaker, but I thought she did a great job, didn't you? Thank you. So we're going to take a little bit of a break now. Don't run off now. I want to see you all come back because we have a lot more to talk about. Jason will be back when we take this little break. Go out there, get your blood pressure checked, and come on back, and we'll go from there. Thank you very much. So without further ado, please welcome Jason.
I want to thank Keith for Dr. Newby, excuse me, he's my buddy, my man up there, for inviting me. This is the second one I've done. First time I cooked. I was, and there you go. He initially asked me if I wanted to cook, and then he said, well, can you talk a little bit about eating on a healthy budget? So I said, well, Keith, 45, 50 minutes trying to cook something and then trying to talk about something over here, it's kind of awkward to do in 45 minutes. So he said, well, let's just talk a little bit. So, I've been listening to some things, and I thought about this. I'm not going to just tell you how to create recipes. I'll give you some what I think are interesting pointers. A little about me, Keith mentioned WHRO. I'm actually on WHRV FM, which is under the WHRO umbrella. I host the Jazz Programming Synod in Session. I also host the R&B Chronicles on Friday nights. Any of you ever hear any of my shows? All right, 7 of you. Thank you very much, right. It's in radio and television. Okay, a lot of informative things about your investments, about your health. It's not just, it's just, I'm amazed. I've worked there 27 years. So I think I can speak comfortably about what we do for the community and what is offered on public radio and television. Also, Keith also mentioned I'm a chef. I don't consider myself a chef because that would be in the professional realm, out there cooking and making money. I consider myself a serious foodie. And I think this is why he wanted me to come here. And this is significant because I don't have formal training as a chef. I have great chef friends that have taught me many, many things over the years. I come from a family, my grandmother was born in Florence, South Carolina. My mother was born in Durham, North Carolina. So you know what that menu was like, right? And growing up in Pittsburgh, I mean, the collard greens would cook 6 hours, right? Yeah, I come from that family with that big piece of fat back right in the middle of the pot. Oh yeah. But growing up, we just become conditioned to flavors. Okay, now I'll say this again. We become conditioned to flavors. So over time, if that's all we're exposed to, and that's all I was exposed to as a young boy growing up, we would go over Deacon Wilkinson's house. Greens, fatback, chitlins, butter, fat, salt. The big 3, butter, fat, salt. Now, growing up with that, once I left home, I went into the Navy. Any vets out here?
Rolling.
No vets? A couple vets. Thank you for your service. Right. I got to a point in my life where, I started to read. I love reading. And I became, mainly because of my job, I became, technological or technologically savvy. So I learned to get around on the internet. Every bit of information you can possibly think of is right at your fingertips. If you know how to get online and I'm bringing this up for a point because, again, keep in mind, I'm not a trained chef, but the information that you need to refine and help you live a healthy lifestyle is right at your fingertips. Everything you need to know, every question you have can be answered on the internet. What the internet cannot do for you is engage you. All right? Because you're talking to a machine. You're asking a machine a question, does it give you an answer? I go to the Mayo Clinic site, for example. If I have health, one morning, about 7 years ago, I woke up about 3:30 morning with this, I felt like I had a Ubunji spear in my side. And I'm like, what in the world is going on with my side? So I got up and I went to WebMD, typed in, I'm like, what's over here on this part of my body? Like, appendix down here, gallbladder's over here somewhere. Well, it's not showing up that much over here. I'm like, what? And I had gotten so sick and I was in so much pain, I said, I gotta go to the hospital. So I go to the hospital and they said, where's your pain? I said, it's right here. She goes, it's probably a kidney stone. And it was, but my point is, that information initially, I was looking for what could possibly be driving that pain. And the same with food. It's the same with learning the health benefits of what we consume and what we put in our bodies. That's what happened with me. I got to a point where I said, I'm an artist. I'm a musician. That's my other life. So I started to look at cooking as a creative outlet that parallels my art as a performing artist and composer and writer and drummer. Then it became a health issue for me. When I would eat out in restaurants, I would say, man, this food is like really, really salty. So I started doing the research, like learning. How many of you know the US daily recommendations for sodium intake? Does anybody know what that milligram would be? Do you know? So, louder? It's 1,500. It's anywhere 1,500 to 2,300. But our bodies only need between about 180 to 500 milligrams of sodium per day. But let me tell you give you a little scoop here. Most of you consume the US daily requirement of sodium by lunchtime. Okay? Same with the fat and same with the sugar. We're going to get more into that in just a moment. So I just wanted to give that information out, that if you have questions, if you're at home, if you have access to a computer and internet, if you have questions about how much of whatever you should be eating, it's there. It's right there at your fingertips. So try to become just a little bit tech savvy, okay? All right, and if you feel like you're too old to be on a computer, no, you're never too old to be on a computer. All right, so in thinking about trying not to get into, how to make recipes and this kind of stuff, let's look at some pointers. One word I want to give you: moderation. Moderation. That's really important. I break this down because let's say you get up in the morning, 8 o'clock, you have a blueberry muffin with some orange juice, maybe an egg or two, right? So right there, you've already put down several hundred milligrams of cholesterol in the egg, particularly the yolk, right? Do you know that eggs are probably the one food that has the highest level of cholesterol? Do you know where to get cholesterol from? Do you know where cholesterol comes from? No? Blood. Now think about that for a moment. What's made with blood? Any dairy product. Milk, cheese, eggs, meats. In meats, the highest percentage of the cholesterol is in the fat part of the meat. A chicken wing. A lot of you, who does not like, by a show of hand, who does not like a chicken wing in here? Oh, the one person, you don't like a chicken wing? No? Okay, all right. The chicken wing has the most fat on the chicken. Do you know that? Because the fat is in the skin. That fatty part of the wing, that's where the most fat is on the chicken. That's why they taste so good, right? Seriously. So moderation. So you've eaten at breakfast, right? Now by lunchtime, you've kind of forgotten about, you're not thinking about what you had 3 or 4 hours earlier. So now, all right, you get this pasta dish with this white cream sauce, and you're drinking the soda, you think you're okay because you got some broccoli on the plate with it, all right? You bought it in a restaurant, so there's salt in their food to flavor the food, but you grab the salt shaker because there's not enough salt for you, see? So you put some more salt on that food. Then you have about a 1/4 cup of sugar you just put down with that soft drink. Do you know where you get the most sugar intake in your diet? Soft drinks. I don't drink sodas. I drink water. It's the drink of the gods. You cannot go wrong drinking water. Get rid of the soft drinks and the juice drinks because they're laced with sugar. Laced with sugar. Now, that's lunchtime. You've already put down, the average person consumes about 3,300 to 3,400 milligrams of sodium per day. Do you know why? Because you're not thinking about moderation. Now you get into the afternoon, late afternoon, dinner time, right? So now you want to have that piece of fried fish, right? Maybe a baked potato that you put about a 1/4 cup of butter on and sour cream. More salt. You see what I mean? moderation. You have to plot out your day until it becomes a situation for you where you don't have to think about it anymore. Moderation. What's that word? Remember that word, moderation, because once you start thinking about moderation, the whole good, healthy refinement process of how you eat can start to refine itself. Now, let's look at conditioning. Remember I used that word? We're conditioned to certain flavor profiles. I think salt is actually kind of addictive. We get used to that flavor of salt. So how can we substitute salt? Some options, you could use citrus, like lemon juice, or orange zest. You know what zest is? It's the peel, orange peel, right? Grated. You can use herbs, like cayenne pepper, or cumin, or sage, or rosemary. I was hearing somebody talk about herbs and other spices like that can work as great substitutes for salt. You just have to get used to the flavor profile. You know, it's kind of like smoking a cigarette, and you want to quit smoking. So most people who smoke and want to quit, it's not like a light switch turning on and off. You have to work and wean yourself off of the process. The flavor, like if you were hungry right now, you can tell me if I'm wrong. If you were hungry right now and you walked out of this building and you smelled fried food cooking, is that not the best smell in the world? I'm not saying you're going to eat it. I'm just saying the smell of French fries cooking, right? And you know what? Our body starts to react to this, right? So it's learning to wean ourselves off of certain flavor profiles and creating and refining new flavor profiles for us. So think less about salt. Salt, sugar, fats. What's a substitute for sugar? How many of you like to bake? Yeah? All right, so you put a ton of sugar in your desserts, right? How about substituting honey? But here's a key. If you put honey as a substitute for sugar, then you're going to have to put less of the other liquids in your food. So this is how that works. You understand what I'm saying? So if your recipe, for example, also required a cup of milk, but you want to use a half a cup of honey instead of a half a cup of sugar, refined sugar, then you're going to have to cut back a little bit on that milk. Or if you have vanilla flavoring, or if you have, it might call for 3 eggs in your recipe, then you use 2 eggs. You with me? You understand what I'm saying? So, and it'll affect, it's not going to affect, it will enhance the flavor of your food, but it will affect the texture part of your food. You with me here? So you have to learn, just try it and experiment with it, and just so you can learn to create different flavor profiles for yourself. All right? Now, there's a myth that eating healthy costs a lot of money. Michelle Obama tried for years to get folks to see, she tried to go to Walmart, try to get them to lower price, and they worked with her. But then there's another part over here that fought against that. Well, you'd fight somebody that's trying to do something healthy for people. You know, she basically simply was saying, we need to get these prices down so people can afford to come in here. You don't have to make a lot of money to eat healthy. That's a myth. All right, so I got some pointers here for you. Create a budget. If you don't have a lot of expendable income, create a budget for yourself. An objective budget for food I'm talking about, okay? Decide exactly how much you think you can afford and be objective and honest and realistic about it, okay? Buy whole foods. I'm not necessarily talking about the store, right? Talking about the whole. Let me give you a little tip on grocery stores, all right? When you go in a grocery store, you want to find healthy foods. Shop on the perimeters of the grocery store. Do you understand what I mean by that? Because that's where the eggs, the butter, the meats, the fish, right? The stuff that we should be eating on the perimeter. You get in the middle part of the store, then we get the box stuff. All right, we get all the processed stuff. And with that processed stuff comes tons of what? Sodium. Okay? So, shop on the perimeter more when you go into the grocery store. And stay out of the middle unless you absolutely have to. All right? Pay attention to, don't buy processed foods. If you're on a budget, buy frozen vegetables, for example. Right? But look on the back in the ingredients. If they have sodium listed in those ingredients, then leave it alone. You have to put some salt in the frozen vegetables. I mean, come on. Same with fruit. I was actually stunned a few weeks ago. I was like looking for something quick, and I broke my rule. I bought some frozen vegetables because I didn't feel like cutting up some greens or spinach or whatever. I just said, okay, I'll just get it packaged. And I can't remember the brand. I got the package out, and I looked at the ingredients, as I always do, as well as you should as well. And it just said, broccoli. It's like, man, something must be wrong here. Like no water, no salt, it's just broccoli. You know how rare it is to pick up a box of anything? Like if you have a box of spinach and you pick it up and it just says spinach. It's like, wow. And we actually think that's strange. That's how out there it is right now. So, but the cost of the frozen vegetables or the frozen fruit, for example, you buy frozen fruit, look, if they add sugar, that's what kills me. You get in a smoothie, like you go in a tropical smoothie and order a smoothie. Why are you going to let them put all that sugar in it? Because there's enough sugar in the fruit. They actually, when I go in and order a smoothie and I say no, they call it what, Terminator? What do they call that? It's a T word, something they use, which is clever because it's really sugar. You don't want no Terminator, what is it? Something like that, but it's basically sugar. And they say, you don't want that in there? I'm like, no, it's banana and blueberries. Come on. Bananas probably have more sugar than any other fruit out there. But it also has potassium. If you notice, a lot of athletes that will eat bananas. Right? So if you sweat a lot, particularly during your sleep, get up in the morning, eat a banana. All right? I'm a little off topic here, but also drink a lot of water when you go to sleep so your body stays hydrated. That's for a whole different medical reason, all right? So, buy frozen vegetables or frozen fruits as an example to get away from the cost of the actual produce area. It's going to be more expensive. Learn how to cook. I don't assume. People can say, I think a lot of people, like women, for example, that have children, they cooked for their kids, not because they liked to cook, but because they had to. And so I know a lot of people, my friends, they grew up hating to cook. Even after their kids were grown and gone, like, they don't cook, right? Because it became like, it felt like work to them. Cooking has to feel good to you. So if you like to cook or if you don't like to cook, learn to like to cook for your health. Does that make sense? Now, there's a way to cook too. A lot of people don't like to cook because there's a lot of work involved. But if you learn to manage your prep work, to manage your time, if you can get your prep work out of the way, like cutting up some onions, cutting up some garlic, that sort of thing, set it aside, whatever. And then when you get back and you're ready to cook, that's why when you watch these cooking TV shows, all these chefs have all their stuff. That's because there are sous chefs in the back chopping up everything for them. So when they get on TV, all their ingredients are right there. So learn to prep better. This will cut down on your time, which will make your cooking feel less like work. Make sense? Okay. Moving along, let's see. Cooked meals, like I love, particularly in the colder months, I love making soups and stews. Not just because of the taste, but because they can last me 2, 3, 4 days. They store well in a freezer or refrigerator for a couple of days. So I might have splurged a little bit, like I love making a potato, kale, andouille sausage soup. Yeah, oh yeah. Oh yeah. Oh yeah, yeah, yeah. Now the only thing a little suspect in that dish is the andouille sausage. Because there's a lot of fat, there's a lot of sodium, and they might have MSG. I don't eat MSG, monosodium glutamate, because it gives me heart palpitations. And it took me for years to understand that a lot of people have reactions to MSG that may not realize it. And there's always been this debate raging about, you know, the effects of MSG. The Food and Drug Administration says MSG is okay, so eat it. However, they put a qualifier on it. They say in small doses. But what they don't say is everyone's threshold for the reaction to MSG is different. And there's also a myth that MSG is only in Chinese and Asian food. Oh no. I cooked and I used Campbell's chicken broth forever because I love the flavor of the broth. But every time I would eat this stuff, I would have heart palpitations. And I'm like, my first thought, I fell into the stereotype, oh, Chinese food, I got to stop eating Chinese food for the MSG. Nope. I found out Campbell's product is laced with monosodium glutamate. So I stopped using that broth and started buying organic chicken broth. Haven't had them since. So it's, man, you just got to pay attention to really when you're buying stuff off the shelves, just pay a lot of attention to the ingredients. Always look at the ingredients. You can make your own chicken broth too. You know how to make your own chicken broth? But back to that soup. Potatoes, I said I wasn't going to give you a recipe. I chop up nice russet white potato. I skin it, take the skin off. Get some andouille sausage. You can also use turkey sausage. Not as flavorful, but good. Chop up the andouille sausage, little pieces. Get a yellow onion, some garlic, a couple bay leaves, some thyme, and that chicken broth. Saute the onions and garlic, put the meat in there, cook it for a few minutes, put the broth in, add the potatoes, the thyme, the bay leaves, the salt and pepper, and I tell you what, you will thank me. You will be emailing me, calling me. Man, I can't believe how good this is. Ask me after this is over, okay? See, that's one of the reasons why I didn't want to delve into recipes. But my point to bringing this up is I make a big pot of it, and it lasts me 2 or 3 days. And I don't mind eating that soup every day for 2 or 3 days. So it saved me a ton of money making that soup for 3 or 4 days. I probably saved $70. Just in, that's eating smart. Learning how to utilize your leftovers in a more effective way where it saves you money. Let's see. Look for sales. You might think that might be common sense, but you'd be amazed. I'm guilty of this myself. I go in, I don't look for sales first, I look for the quality of the product first. So someone might say, I love olive oil and it's better for me, but I can't afford it, so I'll go to Crisco, right? I go towards the olive oil. Olive oil, I'm bringing this up for a point because olive oil is the one oil I will splurge on. I will spend the money for olive oil. I might watch the rest of my budget, but I will splurge. Now, there's a difference between extra virgin olive oil and regular olive oil. Does anyone know the difference? Well, there's several differences, but do you know a couple of the differences? No, the price is pretty much the same. One is more refined and has a higher smoke point, what we call smoke point. In other words, you've had oil in the pot, right? And when you have the burner on or the fire on, you can start to see after a while the smoke coming up from it. When you get to that point with your oil, regardless of whatever oil you're using, that's when you're starting to get the nutrients out of that oil. That's what you don't want. Extra virgin olive oil has a much lower cooking point or smoke point at about 375 degrees. So it's not good for, let's say, frying chicken, because you need a higher smoke point with the oil for chicken, like canola oil, for example, is good for frying chicken, although it doesn't have as much flavor as olive oil. Peanut oil is great for frying chicken, for example, or fish. I don't really eat fried foods. I try to avoid them. I saute a lot of my food, but it's always an extra virgin olive oil. I might use grapeseed oil. It also has a high smoke point, so you can fry in grapeseed oil if you wanted to. Coconut oil, yes, it has a very, very high smoke point, but there's a lot of saturated fats in coconut oil, which are the fats that aren't good for you. You know, you want the good fats like are found in olive oils or peanuts, you know, flaxseed. Those the good fat. These fats also, the monounsaturated fats, also help to lower your cholesterol. You eat foods that are higher in saturated fats, it's going to do a lot of damage to your cholesterol. Okay? So understand cooking oils. Olive oil, extra virgin olive oil is the one food I will splurge on. Like if I see it, it's like $8.99, but then another oil over here is like $3.99. I will splurge on that extra virgin olive oil. Okay, man, it's like zoom by. It's like, learn to, I'm skipping over, I have so much stuff on this, proteins and carbs, okay? Proteins help muscle mass, they keep your muscles strong, right? You can find protein in what? Chicken breast, right? Nuts. So learn, carbs are good for you because carbs help fuel energy, but too much of white pasta, white bread, not good for you. And I have a weakness for pasta, believe me. Pasta, rice. You want to lose weight, cut out all the white food in your diet. Think about that. You want to lose weight, just cut out all the white food you eat, the rice, the pasta, the cheese, the breads. That's how you lose weight. And people say, oh man, you know, I have a hard time losing weight. Well, that's because you love to eat. It's simple. You're gaining weight, unless you have a thyroid issue, which I'm not a doctor, they can speak more closer to that. But in general, most people gain weight because they consume more calories than they expend. Now, if you like to eat like I do, but I'm a drummer, so I'm real physical just about every day of my life. If you like to eat, then you're going to have to be more physical. You're going to have to get up and move. You're going to have to do that 10,000 step a day walk thingy. And if you don't complain about how unattractive you feel about being overweight. You understand what I'm saying? So if you eat a lot of food, huh? Yeah, well, no, I'm saying if we eat a lot of foods, then we're going to have to offset those calories somehow. Okay, we can't eat a lot of foods and just be stationary, because then we put on the weight, and that's bad weight. Okay, and once we start putting on all this weight, 80% of our health problems are diet related. 80% of our health problems in the United States are diet related. Just think about that for a moment. Before the Affordable Care Act was passed, the number one cause for bankruptcy in households was because of catastrophic illnesses. That's insane in the United States. You don't want to get me going down that road, but that's a whole different story. But back to the grocery store. So you want to get your nutrients. Ideally you want to get your nutrients through your diet. Your vitamin Bs, your E, C, D, right? But if you don't have a chance to get that way, get it through your food, then take a supplement, a multivitamin supplement. I take multivitamin supplement. I also take a zinc, a little bit of extra zinc, B6 or B12 vitamin, in addition to my multivitamin. So that way, you're ensuring yourself that you're getting your body's nutrients. Okay, I think I have a little bit of time left, right? How much time do I have left here? Okay, 5 minutes. All right. Let's see. How many of you buy bottled water? Do you know how much money you can save by getting a filter and putting it on your faucet? I'm serious. You can. You can save a ton of money. I started saving so much money just getting a refrigerator with a water filter on it, because I live in Chesapeake, and Chesapeake has horrible water. When I first moved out in Chesapeake, they sent out a notice, and I kid you not, they said, if you're a pregnant woman, do not drink this water. Then they sent out a notice, if you have pets, do not let your pets drink this water. And I said, I'm taking a shower in Norfolk. Since that point, they sent out and they said they cleaned up the water, and they have. But it's not like Norfolk or Virginia Beach or anything like that, you know. So you can save yourself a lot of money by simply putting a water filter on your faucet or in your refrigerator. There's so many things I can talk about with this, but my time is running out. So I want to give you a few moments to ask me any questions if you have some questions, if you're thinking about anything I said, perhaps, or if you're wondering about some of the things you might do to help enhance and refine. Any questions? I'd be glad to try to answer some of your questions.
Don't be shy. I understand that we're not supposed to shop inside the aisles to know, but they have veggie pasta. What do you think? We should just keep reading the back of the boxes or ingredients to make sure.
Don't buy boxed foods. Period. And I know that might be intimidating to a lot of you, but remember when I said go back to the conditioning. See, we are conditioned to buying certain foods because we have flavors that we are naturally drawn to. Another thing about, my man, what's up, Congressman? I mean, to center you out there, Bobby, like that. Made me forget what I was getting ready to say. But we have these, some would say MSG or monosodium glutamate is addictive. It's in everything. How many of you eat Popeyes, Bojangles, fried chicken? It's laced with MSG in that food. That's why I stopped eating it. Once I found out, once I realized what I was having a reaction to with MSG, I started doing the research, and I was just absolutely astonished how many places, fast food, and not just fast food, in restaurants, will put MSG in their food. And here's the one thing that I noticed about a lot of some restaurants, particularly in Asian restaurants. I will ask them, do you put MSG in your food? No. I'll say, I'll ask you again. Do you put MSG in your food? No. I said, okay, so if I eat this shrimp fried rice and I fall out on your floor with a seizure and it's concluded that I had a reaction to MSG and I come back here with my attorney, oh, well, you know, it's in the soy sauce, you know. But here's the interesting point about this. They are not, in some cases, technically lying. They are not. They say they are not putting MSG in their food, but it's in their canned products. It's in their broths. It's in their oyster sauces. So if you really want to avoid it, ask them, is monosodium, and then they'll say, say MSG, don't say monosodium glutamate, because a lot of people don't even know the longer term for it. Just ask them, is it in your broth? Is it in your oyster sauce? Because they use broth or oyster sauce a lot to make their sauces. Okay? So that's one little point. So another question?
Yes, thank you. I would like to know, I know salmon is one of the recommended foods as well as tuna. How would you recommend canned salmon? The fresh is very, very expensive, especially the wild caught. So what would you say about canned salmon?
That's a great question. Personally, I don't buy canned anything. I'm not a big fan of salmon, but if I eat salmon, I joke about it, I say I have to put clothes on it. Like I made salmon last night, I made salmon cakes. And I always buy the wild salmon, and you're right, it is more pricier. I buy that because the farm-raised salmon is not, a lot of the nutrients are depleted out of it. And you can tell if you want to know, not by price, if you want to be able, do you know how to tell wild salmon from like farm-raised salmon? The wild salmon is darker and richer in color. There's like a deep, rich orange color to the salmon, okay? So if you're going to buy the cans, I would look at the sodium content, right? Try to find the tuna or the salmon with the least amount of sodium content. And if there's anything else in there other than sodium, do not buy it. You want to stay as close to the natural as you can. Now, canned tuna is not necessary. I would recommend canned tuna over canned salmon. Couple more questions?
One question. I'm going to ask you one question before it's all said and done. I'm going to let her ask hers first.
What suggestion do you have on how we should handle our holiday eating, which is coming up really, really soon?
You know what? I don't know if you're going to love this answer or hate this answer, but I say on holiday, go for it. But do you know why I say that? Because that's the only day of the year you eat like that. Thanksgiving and Christmas, I say, man, just knock it out of the park. just throw it down, you know. But then get back to that moderation, right? And I'm serious. It sounds like I'm joking with this, but I'm saying if you can manage the moderation, if you can control your impulses throughout the remainder of the year, okay? Remember, think moderation from the time you get up to the time you go to bed. Think more about what you've consumed throughout the course of the day. Moderation, conditioning, okay? So by the time Thanksgiving comes along, man, it's like all gloves are off for me. Keith?
Final question is one of the things my extremely lovely wife that's sitting in the back asked me earlier was, and this is something we have discussed because this is reality what we see. In practice, patients come in because they're on a very, very fixed budget. And oodles and noodles or ramen noodles, whatever you call it, that's like the delectable choice for most people. Now, the question would be A, if they're going, because they buy 10 packs for like $1 or whatever they do. So the question A is there any way to make it not so? Well, I won't say that because I think they got the packs and they throw all the packs on it. We know kind of partly that, but just the realities are that people buy that stuff and they eat that stuff and they make that part of their dietary everyday life. What alternatives, if they're going to do this, what could they do potentially? If they, but what are some good alternatives to that would be extremely cost effective, yet still relatively healthy? I mean, because we run into this all the time.
And you know, when I was in college, that's all I ate. So I know about those ramen noodle things. First of all, that stuff is laced with salt. I mean, there's so much salt in there. When I hold a package in my hand, I can feel the weight, and that's salt. Keith, I mean, the way that I can answer that question is, again, you don't have to go. If you find something like that in the middle of the aisles, remember I told you about the perimeter of the store. If you find something like that in the middle of the aisle, chances are it's not going to be that good for you, unless you are shopping at Whole Foods because they have a strict policy about additives in their food. They don't put additives in their food. You pay more, yes, but the substitute for something like that, man, I would just say buy 2 potatoes. You know, bake a potato. It's filling. Put a pinch of salt on it. You put a pinch of salt and a little bit of real butter, not margarine, on that potato. You have eaten 20 times more healthy than you would if you eat 1 pack of those ramen noodles. Or if you really got to have something pasta-ish that resembles a noodle, then buy pasta and get some real butter. Boil the pasta, put some real butter in there, and some garlic-flavored olive oil. Or leave the butter out and just still use the garlic-flavored olive oil. In the water that you boil the pasta, get some asparagus, some frozen asparagus. cheaper than produce out, right? Chop up, inch and a half. Once you cook the pasta for 11 minutes, then you put some of the asparagus in that water and boil it for a little bit more longer, for about 5 minutes. Then drain the water out, put the pasta in there with the asparagus, and put some garlic flavored olive oil and a pinch of salt and pepper, and you will never buy ramen noodles again, ever. It's thinking, it's refining your taste, it's refining your flavor profiles, and it's within a budget. I think it's very affordable.
Well, thank you, Jay. Appreciate it very much. Thank you.